Your brain is interpreting your entire reality. When people say, I want to get to the root of the problem, there's not really a deeper root than your neurons. My name is Dr. Lars Landers, and I'm a functional neurologist and chiropractor at Restorative Neuro. My job is to identify where the brain is not functioning optimally and to address that. Many of my patients are struggling with the effects of stress, the effects of trauma, the effects of injury related to brain health and function. So in other words, I see a lot of anxiety. I see a lot of depression, obsessive compulsive behaviors. I see a lot of people who want to improve their memory, whether it's after they've had a concussion or if they feel like they're not as sharp at work. We can take a person's function where it is and then attempt to boost it. What inspired me to start Restorative Neuro was watching the things that my community are dealing with, meaning their neurological function. So I'm not a mental health provider, but I do identify where the brain is operating in a dysregulated way using our objective tools. And then the goal is to help it resynchronize its behaviors. And lo and behold, the negative symptoms tend to fall away. Let's go to where we can see that the brain is not functioning optimally. Treat that, encourage the brain, essentially force the brain gently to build better ways to operate in the ways that we can identify are not optimal, and these symptoms improve. We use our equipment, quantitative EEG brain mapping, to record the electrical activity in the brain. The brain map is an extremely important piece of objective information collection in here. Oftentimes, I could look at how that brain is performing and predict at least some of the symptoms this patient is experiencing. We're going to see that in the brain map. The process here at Restorative Neuro for treating patients, objective data is essential. It shows us exactly where to aim it and exactly how to support it, where we need to lighten the cognitive load, where we need to push a little harder. At the end of the course of care, when we do the reassessment and the patient says, I feel better in the ways that I meant when I came here, we can look and say, well, you actually function better. So it's no accident that you feel better. And that increases the likelihood that it's going to be function that is sustainable. It's unrealistic to say coming to any treatment is going to result in, okay, my life's perfect and stress-free from now on. Our goal in our treatment is to make your brain so capable of handling stress that we can reduce the size of the stress pile by increasing the function of the brain. The most effective way to work in this space is to say, all right, we're in this together. I'm here to navigate, but you're gonna drive. My goal is to always help people find what works for them.